How effective are masks in preventing, particularly for people who travel? If they are effective, what type of masks should we buy?
Okay, so masks are not very effective at all in trying to prevent the spread of coronavirus for the general population. So although we've seen lots of video of people walking around with masks, in fact, actually what happens is, if I'm wearing the face mask and I'm coughing and spluttering, guess where all those droplets are going? Does anyone know? She gets it. She gets it, the person right next to me. So face masks are not very effective at all. They are useful if you're in a confined place where you're sat with other people in a close environment. So if you're, for instance, sat on a train or on a plane, then it may be of some limited use. But I think that's all it is, and I don't know if anyone else wants to add to that.
No, I agree with that. I was looking at the guidance. The Public Health England has given the guidance. They also suggest that the surgical face masks are only effective in the clinical settings where you deal face to face with the patient. But otherwise, I think for the public, they don't recommend wearing the surgical mask setting.
Okay. Any other question?
You mentioned that we need to be in contact with somebody like to reach out so for 15 minutes. Let's say somebody is sneezing or coughing, so what with the time then? Is it just that whenever they pick then up probably I can catch it even before that?
So hopefully you will carry your tissue in your pocket with you, so you could potentially give it to them and then get away from them, or remind them what to do. That would be my advice again.
Yeah. Again, I think what the Public Health England has given the guidance is the 15 minutes is for the infected patients, so they will be obviously coughing and they have the symptoms of the flu-like illness as well. So the 15 minutes is generally the advice for any respiratory illness. So that's for the flu as well, for the common cold, and same is for the coronavirus. So I think that's what generally is advised, that the 15 minutes, if it's less than 15 minutes, is less likely. Again, we can't give you the guarantee that you won't get infected. And again, it's a novel coronavirus. It's a very new entity, so we are still working on it. So we are not completely sure that how it works and what is the incubation period and what is the infective time and all that. But the generally advice for all the respiratory viruses and the respiratory illnesses is the 15 minutes face-to-face contact, which means obviously the 2-meter distance or in the same room.
Any other question?
Yes, what? How do I get my elderly mother to not get this virus? So she suffers from asthma, she's got blood pressure, she suffers from diabetes. What do? Just lock her up?
I think that's a really interesting question, because that generation often did the complete opposite. They worked really hard. Sorry. Yeah, sure, sorry. Sorry. So that generation always, and I'm making a general statement here, but generally speaking, they always think about everybody else and they don't think about themselves. So it's actually a very, very difficult conversation. If I take I'm sure my mother won't mind, my mother was a GP as well. She's over 80. And she's got a number of health conditions, and she said, I can't wait to go and work back in general practice to support people. I said, well, Mum, you're actually a very high-risk person based on what we know, and actually that's not such a good idea to do that. So the first thing is to think about what they want, and then start to think about, do they need to be going out where they might be at risk of picking up things? But there's a balance to be had between staying in the house and being able to go out and about because you haven't got it. So there's a balance to be had. I think it's a conversation that needs to take place, probably with the family together in terms of what's needed. Back to the thing about, do they need to go out all the time, or do they go a few times? And if they do they go to open places, or do they go and sit in a cinema watching Indian movies, sat next to everyone else, and then suddenly finding that they might pick something else? But I don't know if others want to add to that.
I'm looking behind the category of that just to let me lie down and let me go. Enough. But we're answering the simple things. How many people are damaged from a cold every year? I've experienced national service for 30 years plus. You are the expert. On anything. Okay? Second, You see people going in hospital. Do they wash their hands with alcohol? And that person who is in charge of this business of hygiene, whether they're Muslim. The Muslim people will not wash it. I'm an alcohol expert as well. It's absorbing your skin. Okay? My wife I'm using. Okay? The expert just said, I watch these things very carefully. My friends were dying, or my daughter. He said, use alcohol base, which is safer and will get rid of it. Now, who the hell the people will listen to? I'm not challenging you, I'm just saying. Second, people can't cook food, either they have to buy takeaway food, and it's filthy place. I'm watching my own eyes. I don't go into the restaurants that have poison in London, Razzaq is on that side. Why? Because they're throwing takeaway.
I think you make a very valid point there. No, I agree. You make a very valid point. A billion people get flu across the world, and I think it's 250,000 people die in a year.
Yeah.
250,000 people in a year die of flu. We've got about just over 100,000 with COVID-19, and we've got 3,000 deaths. 40,000 people every day die because of TB. So you could argue that this is a huge storm in a teacup, and people are making a lot of noise. I mean, even in this country, 2 people have died of COVID-19, and all this noise is being made. But then remember that we've seen the impact in China within 3 months of what's happened. And things could change very rapidly here, which is why we're trying to provide the best advice and guidance that we can based on what the experts know about that can help. We as doctors are no different to everybody else in the sense that if we're not washing our hands regularly because other people aren't doing it, that's why I think it's important that you point the fingers to us and we help each other.
Simple suggestions. When hospital times, I said many times, they very wash their hands. When they heat up the stethoscope, do they clean the stethoscope while you another one? They don't.
Okay.
And you've got haircut accents.
Okay.
No idea whatsoever.
Okay, so we'll move on to the next question. In one of the... Sorry?
Just one question.
Yeah.
Being a Muslim,
Yeah.
if somebody died from this infection,
Yeah.
what would they do to that body? Would they keep it in the wall for several days? Or what would they do? Because being a Muslim,
Yeah.
we know that straight away is we try to beg the person.
Yeah.
So please can you answer this simple question?
Yeah, the context of attending the janaza, the people get infected.
Okay, so at this moment in time, we don't know the answer to that question. I will take that back because I think it's a very relevant, very important question. The virus will be in the body for at least 8-9 hours, I would have thought.
Right, yes.
So therefore, it may not be safe to wash the body and things within 8 hours of that, but I think we need to take that question
Yeah,
back.
and the other thing is, sister, also the recommendation is that any patient who dies of the novel coronavirus has to be referred to the coroner. So that's what is the recommendations at the minute. So anyway, it will take some time, and by that time, obviously, we are hoping, that's what we know it from the studies, that the virus should have died anyway, and also because the body will be covered, it won't be exposed. It will be in the coffin itself, so there will be very less likely there is any chance of contamination or infection, risk of infection to anybody else. The ghusl again is, I think, because it will take time for the coroner and all that. By that time, they will be fine to do that. But again, this is what I'm thinking. There's no clear guidance so far at the minute we have got.
But doctor, once again, simple question. Would they automatically do a post-mortem on this person?
No, it's not the post-mortem, no. They will be referred to the coroner and they will be investigating in terms of that, what was the cause, and there are some legal bindings which we have to do, the doctors have to do it. So they will be doing that, not the post-mortem, no. That's a separate
It's
thing.
a notifiable condition, so we have to notify, but you only do a post-mortem when there's doubt on the cause of death. So if it's clear that they came in with coronavirus with the typical symptoms, their body responded, so if they developed the severe illness, and I don't know if you want to say a little bit about acute respiratory distress syndrome and what.
Yeah, We basically support the organs in ICU. We don't, we will probably treat it as same as influenza or any other respiratory illnesses. So we just support the organ till the time it responds. Mortality is higher than influenza, of course. For influenza it's 0.1%, this is around 2%. So it's higher than influenza. Having said that, we'll treat it same as influenza. We are quite trained, we have got equipment, everything. We have got shortage of ICU beds, there's no doubt about it, but still we can treat it if we get this kind of case. In my setup, we haven't received any case in ICU yet, but we are kind of prepared to receive these cases if this happens, if it comes to that point. And we are expected it to happen sometime soon.
Yeah, you mentioned in one of your slides that the risk level to the UK is moderate at the moment. How many more people need to be infected? How many more people need to die before that changes? What are we waiting for? I mean, we see what's happened in China.
So, essentially, the way we care for patients is not going to make any difference. The difference in terms of the level of risk is it releases certain resources. So the government has certain powers as a consequence of that. I've been invited to go to a meeting with the police on Friday to start to understand what the service delivery will look like. Those sorts of meetings start to escalate as a result of the status. That started because the World Health Organization turned around and said the status is now high risk. As soon as they announced that there's a pandemic, that will then again lead to changes. That means that the government can activate the army and other things like that, which they wouldn't have been able to do without that status. The status thing is really about releasing resources rather than changing the way we deliver care.
So at the moment we have our children, obviously they go into schools and that, and as you said, you know, this virus, it gets sort of gets passed on through sneezing, coughing and that, and obviously, you know, the virus could sort of end up in clothes, children's clothes and that, or on surfaces, objects and that, and this virus sort of stays alive for, you know, 10 hours or so. So, I mean, we don't know. Kids go to school, they come back, whether they have that virus in their clothes or something sneezing, do they need to wash the clothes? I mean, what's the advice on that clothes?
So, if we look at what's happening in other countries, in Italy, for instance, they've now closed down all the schools for 14 days. In China, they shut down really the whole cities for weeks. And the purpose of doing that was to stop gatherings where people come together and where they can spread the virus much more. What we can say is that in China, there seems to have leveled out the number of people with cases. So what they've done seems to have stopped the spread in what's happened. And in Italy, I guess, they're trying to control things at the moment.
So I think, I mean, just to add on, if obviously at the minute, I mean, so there are the different responses which the Department of Health is giving. So the initial response, there is like a 4-stage response from the government, from the Department of Health. So the first one was to contain the disease, which we have passed that, and we are now at the process of like a delaying the outbreak of the disease. So what that means is that anybody with the severe respiratory illness are now being actively investigated for the novel coronavirus, regardless of the travel history. So I think, I mean, if we find more than what we are expecting at the minute, more cases, then it will be classed as kind of like a pandemic, or it will be, we will go up to the mitigation stage, and that will be the stage when we probably will have to stop the schools and like all the public gatherings. So we are not at that level, but we are actively looking for the cases now at the minute. So anybody coming to the hospital, admitted to the critical care unit with the respiratory illnesses, we are actively testing them at this stage.
Another question? Yes, sir.
Is it true that, I mean, the patients or a person infected with coronavirus will be at peak in next 2 months? That's what I heard from the article.
So again, if you look at all we can really go by is what's going on in China. And you can see here that it was 309 cases on the 21st of January. It's continued to rise, but if you look at this slide, it was rising up and then it seems to have leveled off. So what they've been doing, this is around 17th February. So you can see that whatever they've been doing over the last 2-3 weeks, it's started to level things off. It hasn't started dropping yet, and nobody knows what's going to happen. But we also know that they shut down the whole cities for 3 weeks, so there's been no movement. Now people are starting to start up again because they need to do that. The question is it going to suddenly start rising again because people are meeting? So we don't know. Is that?
Yeah. Yeah. What happens after calling 111? How is the test ordered? What is the process?
So every area has different. Every area has different procedures at the moment. At the moment, what's happened is they've created these pods that are in each hospital. Actually, not in the hospital. They're actually in car parks and places just outside. And you'll have seen on the television where they're creating areas that you come in a car, you stay in the car, and then a nurse or a doctor with protective equipment comes out and swabs you whilst you're in the car itself, and then you come out again. So you don't actually come out of the place at all. So every hospital at the moment already has that in place. If it starts to go like I've shown you here, where you've got thousands and thousands of people getting it, well, clearly one hospital, one pod isn't going to work. And so one of the conversations that we're having is that every neighbourhood should have its own place to go to. And a neighbourhood is typically made up of about 30 to 50,000 people. So for instance, in Tameside, where I am, 200,000 people, there's 5 neighbourhoods. Okay, and it may well be that each neighbourhood has one place where you can go to as the numbers rise. But at this moment in time, you'd be advised to go to the hospital, but 111 would advise you about that.
Okay, Nina?
Dr. Fozia, is it possible for you to answer this question? I have my brother is actually the same thing like you, microbiologist. How are you keeping yourself safe in the lab when they're doing this, especially with a patient with corona?
Yeah, sure.
How do you keep yourself safe? Because I'm worried about my brother.
Yeah, sure.
Please.
Yeah. So we have got obviously the special instructions where we will be wearing the special protective equipment. So the special masks. That's right. Yes, yeah. We will not be exposing ourselves obviously, because obviously our own safety comes first, and then obviously we have to work in the lab as well. So the specimens come in the double containers already. So there is a specimen, one bag, double bag, another big container. It comes out, and then we have got the safety cabinets where there's a negative pressure, so it just kind of like sucks up all the material if it's leaked or anything. And we have got the special protective equipment. You'll be wearing masks, eye protection, and the gowns and the gloves and everything. So yeah, I think we have got all the measures in place. So to minimize the healthcare workers to get any kind of infection.
You're so special, you see, we want you to be around. Never mind what's the
Thank you.
Thank you.
Yeah. She's also worried about you as well, not just about her brother.
Thank you.
Yeah. Sorry, there was a question.
If you catch coronavirus and you're diagnosed with it, and if you are cured with it, do you have more chance of getting it again?
Recurring. Is there a chance of recurring?
Yeah, well, I think it's, again, because it's a very new virus we are coming across at the minute, we don't know much about it at the minute. So once you have recovered from that specific type of the virus, we think that probably you shouldn't get it in the near future. But the problem with these viruses is they keep on changing. So every season they will change themselves. So then there is chances that you might get infection again. So again, I mean, it's a very new field at the minute, so we don't know yet. But most likely, I mean, we are hoping that once you are infected for that season, you are protected with that, for that infection again.
I think there was one person who's been reinfected though, isn't there? There is one person in the world who's been reinfected. That's
right, yeah. I mean, there's been reports that, again, because it's a very early and all the news are coming, so we are not sure at the minute. I mean, whether it was like a reinfection or what we have come across in other cases, that once a patient was positive, he tested negative and then he was positive again. And we are not sure whether he got it reinfected or whether he was not cured from the previous infection and then the virus started shedding again when his immunity went down.
But will it take around, you mentioned 18 months for this vaccine to be developed or so?
Yeah, well, it takes 18 months. I mean, the vaccine itself the actual vaccine was developed within 24 hours, I think, once they had the DNA. But the problem is that they have to grow it and they have to test it. They can't just give it out live. The testing phase is why it takes 18 months. And in fact, 18 months is pretty amazing, really, because in the past it was 5-6 years or so, wasn't it? So, I mean, do you know more about that, Sam?
Yeah. I think obviously, yeah, because again, it's because it's a novel virus. I mean, it takes time, and but obviously, including the Department of Health here in England and all over the world, they are working quite fast on it. So that's what I think. Presumption is that hopefully it should be available within the 18 months time. But again, because I mean it changes so much so fast as well, it's difficult to guarantee anything. But I think at the minute we are thinking probably it will be hopefully in 18 months time we should have a vaccine which can prevent us from like influenza vaccine we have got it. But I mean bear in mind obviously the virus changed. So just like the influenza, I mean the influenza vaccine has to be changed and updated every year because it keeps on changing and mutating itself. But then let's hope for the best. I mean, there's a lot of investment in terms of the time and the money as well at the moment.
Well, it's good to say that even China, it's sort of leveling off the peak there. Probably, they're isolating people. I happen to know one or two people in Wuhan, they're trapped there, some scientists in the university and they've been there for about a month now. And there's a lot of these psychological disorders there, it's quite sort of difficult. Any other question? Let's just take one last question.
I've got a question then. So, if I can ask yourself, from Three Meem Foundation's perspective, what do you think the foundation's role is in this, besides putting the talk on?
I think it's just basically making the public more aware of what the risks are, and obviously to avoid the panic sort of situation where you worry more than what you should. But also the more important is awareness to everybody in the community, and it's not only for one area, it's just we try to spread this information to everybody in the community to get more details about this. And it's more knowing about this virus, more you are able to protect yourself and also your families.
And I think it's clear that Dr. Amir Hannan's talk has highlighted that yes, the threat is there, it's deadly, people have died, but there's no need to panic. So I think, and he's given a lot of good advice as well.
But the thing is, if somebody is contagious, somebody like in our household, somebody is contagious,
Yeah.
how long is it that the other person will get?
But he's given advice on if you are to sort of isolate yourself, what to do.
What was the question again?
No, what I'm asking is, look, I'm looking after a very, very sick man. Okay, you name it, it's not a long list. Okay, all of a sudden, you develop coronavirus. How am I going to deal with
Okay, so
the main carer?
So if you're someone like that and he's in the house and he hasn't been out and about and things, he's not going to suddenly get coronavirus. The only way he can get coronavirus is if he sits next to somebody else who's got it as well. So the safest thing for him is to stay in the house itself and not go out and about.
So I'd like to thank Dr. Amir Hanan for his fantastic presentation and our panel as well for answering the question. Let's give him a hand. Thank you very much. I'm sure you learned a lot about